Our societal pressures often lead us astray, and our worth is actually not tied to our career titles, and often the societal constructs actually pushes us away, or encourages us to steer ourselves away from what truly matters in life. The core of mental toughness is actually self-compassion. I didn't know that at the time. I know there's hope, and I know that we can break this apart such that you can create the life you never even imagined was possible.
Thank you, everyone, for joining. My name is Dr. Stephanie Moss. I am a CGY1 psychiatry resident from the Life as a Patient Doctor podcast. Today, I'm very excited to interview Dr. Jillian Rigert, who was in training to become an Air Force oral and maxillofacial surgeon when she developed suicidality and was hospitalized for anorexia nervosa. Open her eyes to the lost sense of humanity and true healing of the mind, body, and soul in traditional Western medicine. Now, she is a Martha Beck Wayfinder Master Coach and has a Master in Marriage and Family Therapy. She is dedicated to bringing true healing back to the healers and supporting healthcare professionals in finding their way home to themselves. She is a host of A Life True to You, a YouTube channel devoted to supporting high achievers to release themselves from societal pressures that lead them astray in order to create an authentic life true to their values. Thank you so much for joining us, Dr. Rigert.
Yeah, thank you, Dr. Moss. I am so grateful to be here. I love everything that you do and the opportunity to have met you once before, which you're just such a delight to talk to with such wisdom and so much to share from your own journey. So I am honored that you have invited me to share a little bit of my story as well.
Oh, you're so kind. Thank you. Now, tell me a little bit about your story. We heard a little bit, but go ahead, wherever you want to pick up.
Yeah, your podcast often is going to reach all these high achievers that often chase a career title in order to have some sense of worthiness and value in the world, and one that becomes our identity. So similarly, I was on track to become an Air Force oral maxillofacial surgeon, thinking that once I reached that destination, I would feel worthy, whole, valuable, untouchable, all of the things. But once I was in residency, I had such deep emptiness that I thought, okay, here I am in the Air Force, which I loved. And then in surgery, which I had faced challenges with some existential crises because I felt, I'm not sure if this is the path I want to be on. I loved therapy when I was in undergrad. I thought I'd become a psychologist. And I just thought, now all my patients are asleep. Our clinic is really fast paced. Usually we're in their mouth. I can't hear their story. And I just felt like the key points of what I connected to patients on were missing. And then when I had the sleep deprivation, I became suicidal and I couldn't think my way out of it. In order to cope with the challenges I was facing with that psychospiritual and then eventually physical distress, my coping skill was anorexia. So not eating and compulsive running was a big part, and not to share too many behaviorals because that's not often helpful for people, but just to share those were my numbing agents of choice. And when your numbing agents such as overwork, not fueling, and exercise are actually celebrated by society, it drove me very quickly into a very grave state where I almost lost my life to anorexia. And it made me think, what the heck is this life all about? And I realized that our societal pressures often lead us astray, and that our worth is actually not tied to our career titles. And often the societal constructs actually pushes us away, or encourages us to steer ourselves away from what truly matters in life.
Holds so beautifully, and thank you for your vulnerability and sharing that. Even when each of us have different forms of coping skills or different challenges, I think a lot of people will relate to that, and that feeling of emptiness. I connect with other maybe patients that I've had, that when they're in so much distress, that sense of emptiness and disconnection, I've heard, is pretty common.
Yeah, there's a lot of shame often that we don't talk about because shame thrives in secrecy. And so even when I broach conversations, I'm a huge advocate of therapy, and I'm talking to a psychiatry resident. And I'm in Master's in Marriage and Family Therapy. So clearly I think it's worth pursuing. But when it comes to to shame or anything that's shame bound, especially if it's become internalized and part of your identity, I realized the things I kept getting stuck in this perpetual pattern of, gosh, why am I not able to progress out of these deep core wounds I'm experiencing? And I kept feeling like the same things I wanted to talk about with the therapist for years were the same. I'm like, why am I not able to overcome these things? And then I realized because some of the things I wasn't even aware of for myself were just so shame bound, that sense of never enoughness, not worthy. If people find out the truth about who I am, they'll think I'm a disgrace. They won't like me. And often that's created in childhood, maybe before we even have conscious awareness. And I give the caveat that when I reflect back, I see it as a generational trauma that's passed on, not to reflect back and say, oh, I'm going to blame my parents. That's not helpful. But to see the context of their situation and understand, and then choose to break that trauma and say, how am I going to face it to heal it so I don't continue to pass this on with compassion, curiosity, non-judgment, which can be hard because it brings up a lot of emotions that I do want people to know. Like for me, I choose to honor the anger. I choose to honor those feelings and say, okay, good. I'm angry because I see that this is an injustice. I see this is wrong. I see I want to change this. And then we can leverage anger in order to take actions that feel appropriate and in alignment with our values and the outcomes that we want. So all of that was to say, so many of the things that we struggle with, one, shame is common experience. Our society often leverages shame to continue to keep us in oppressed situations and keep us thinking that we have to keep achieving more and more. And so once we become aware, we can detach ourselves from believing that emptiness that we just talked about is going to be filled by achievements, perfection, all the things we are led to believe. That's not going to fill that void.
Yes. Oh, I agree with you. And you said so many great things about that. I could get into just being the psych. I'm like, oh, intergenerational trauma. One of my passions is trauma. I'm actually about to present this week on trauma-informed care to my residency. So I love that. But I'm thinking back, okay, so how did you jump? You're in residency, you're feeling this emptiness. I feel like, thankfully, my program, we do a really good job. However, we are the exception to the rule. So how does, especially I've heard in surgery residency, how does the culture and just what for people who aren't in residency, especially surgery residency, how does the culture perpetuate those things that you were talking about, sleep, food? How does that play in?
Yeah, it's normalized. Most of us just accept that we need to be a bit superhuman, which is actually also to not feel shame. People can either under or overperform, just not accept their humanity. And so in surgery, you'd be looked down upon. If it took me a long time to say, hey, during call, I'm feeling suicidal no matter what I do. And also you're told and taught that you need to know things before you learn them. So you're constantly being pimped. I was fortunate that my program, the majority of the attendings were very compassionate people. They weren't the stereotype surgeon that were going to throw things. There were some individuals who unfortunately were females that I thought would be the people that were supportive of me, but they were, I think, impacted by also being women in a male dominated field, that I felt I had the hardest time because I thought we should have this womanhood. And often they used the way that they taught was very shaming. And I realized it was very activating for me because it represented a lot of how I was raised. And because I was shame bound, surgery, usually we think we're going to break you down to build you back up. But because I was so shame bound, the leveraging of my shame just broke me down. And I have since heard Brene Brown talk about mental toughness. The core of mental toughness is actually self-compassion. I didn't know that at the time. So I thought I needed to leverage that inner critic in order to develop thicker skin, which now I just know is bullpoop. So it definitely perpetuated my shame to be not only in that culture, because there were people who were definitely very compassionate, but because I had internalized the shame and had a stereotype of what I thought it meant to be a surgeon, I further made things worse in my own mind.
Hear you. At what point did you decide to step away from medicine? I'm going to leave it of that question. What did that look like for you?
Well, I was in oral surgery for 3 years. I finished med school, and then I was discharged from the military for seeking mental health support, which is a big pain point for me. I'm now learning to be an advocate because I really feel strongly about how the stigma that is in mental health care for most people, we're leading people to just not get support. So I got support. So I was actually in a better place than people who had chosen not to get support for their mental health and might be leveraging substances or might be just suffering in silence or might take their own life. We shouldn't see this as a weakness. I was devoted to staying in the military. I went to appeal in order to save my military career, but I had been so beaten down in my own mind about you're not worthy that when I went to my appeal, that voice had just taken over. And I don't think I showed up as well as I could have had I just honored the truth I know now is that seeking mental health support is a sign of courage and also just normal. It's just the conditions of which I was living in were not conducive with overall well-being. Had I not had challenges mental health wise, that would have been pathologic to me. Now I'm like, oh yeah, basic needs weren't met. Safety wasn't met. Clearly my brain was showing me something. Clearly I needed help, but instead of getting real help, I was shamed for it. And then we talked a little bit about in my bio is I learned that Western health approach to inpatient psych is very dehumanizing and objectifying at times. And so I was further felt unsafe, which was hard for me because I'm like, well, I work in this environment. I thought about going into psychiatry, and I think there's psychiatrists that you're very humanistic. You see the whole person, the way that your perspective is. It's different than some. It's different than the care that I received by some, but not all, just some. And it just takes one to feel like you associate everything with that sometimes. But I was having this inner conflict of, oh, I would switch into psychiatry, but I'm really concerned about the way it's going right now for me, the way that they're treating me, and I needed time to heal. So when I left oral surgery, I went into oral medicine, which is another specialty of dentistry that straddles dentistry and medicine. And I found my niche in head and neck cancer. I loved working with patients with head and neck cancer because I felt like that was the population I could help the most. But they were coming to me when they already had side effects of radiation therapy. So they were coming with such distress, they didn't want to live. So I wanted to be on the side of prevention. So I ultimately became a research fellow in radiation oncology to try to reduce the side effects of treatment so that when patients were done with their head and neck cancer treatment, they can have a better quality of life and not be in so much distress from the physical symptoms. And then I realized my role is I'm still more fascinated in the psycho-spiritual aspect of people suffering and healing and support. So I felt I didn't have enough time in the role I truly wanted to serve in, which is providing meaning-centered psychotherapy for patients and for healthcare professionals who have lost their why and their meaning in medicine because of the way that it's being currently practiced and limited. So that's where am I feeling most fulfilled? It's I value the opportunity to really help people to ground themselves in their inner being, to honor their spiritual selves living this human experience, to really focus on what matters to them when they're disillusioned from a catalytic event such as cancer or from realizing they spent their whole youth and early 20s and 30s training for something that isn't what they thought. Once they reach that very high distress point, I like to be there for them because I was there. And I know there's hope, and I know that we can break this apart such that you can create the life you never even imagined was possible because we were limited by the societal construct of who we should be.
I love that. It's so interesting to me how you didn't stop in different paths. You went to one path, head and neck, no, it's still not it. And you didn't just say, oh, I'm done with medicine, or I'm done with helping others, or even just giving up. Just the continuation of, okay, and trying to, and just being in your own path and journey, I think is so valuable for people to hear, because life and journeys aren't linear. There's all different things, and there's not one set profession or one set way to do things. And I really love how you really took us through of how you went. So what led you then to this family therapy and coaching route, which is a little bit definitely separate from research and medicine, head and neck? How did that come in?
Yeah, I think they're integrated. It sounds different, but also very integrated. So when we talk about burnout a lot, I think burnout gets overused for terminology that also is being inclusive of moral injury, PTSD symptoms. There's a lot of trauma going on, existential spiritual crises. A lot of people group that into burnout. I'm like, there's something more going on here. This wasn't just go rest a little bit more. And I think people that I took so much off my plate, now I'm still burnout. What's wrong with me? I say, what else? What need truly wasn't being met there? And I think it's more than just burnout. And so when I finished my oral medicine residency, I was an attending focused on head and neck cancer patients at an institution when COVID hit. And that's when everything got shut down. And I still didn't have enough coping skills to not depend on my core one, which was anorexia. So I got to another life-threatening state in 2020, 2021 timeframe, but I was so traumatized by inpatient experiences in residential treatment for an eating disorder, which was limited because they couldn't keep me because of my heart rate. I was like, I gotta do something different and I don't know what it is, but I can't do what I've already done before. So I was in a group on Facebook called Empowering Women Physicians, which is led by Sunny Smith, Dr. Sunny Smith, and she introduced me the concept of coaching for burnout. It was said, I'm like, okay, something I haven't tried before, and I'm an athlete. I like coaches. I'm interested. My family made fun of me. As I said, they're talking about life coaching. And I'm like, I'm desperate because I'm about to die. So I'm going to try something. And so then I was like, but the coaching program that people were talking about didn't resonate with me. But then someone shared about Martha Beck. I hadn't heard about Martha Beck, but they shared about her program, Wayfinder Life Coaching, and her book, The Way of Integrity. So I had read her book, The Way of Integrity, which talks about her journey and how she left the Mormon religion and she had become an academic at Harvard, gotten a bunch of degrees from Harvard, and she was trying to teach there, but she's just feeling ill. Her life that she had she just felt like something was very off. She just kept getting sick. So eventually she said, screw this all. And she went on her own path. And she realized that in order to be well, we need to live in our integrity, our authentic self. And her life journey just was paralleled so many similar things that I was experiencing that I was like, I feel seen. Something's here. So I took a chance on that program. And it was right before I started my research fellowship because I had realized that my attending job in hospital dentistry, I'm like, this isn't it. I don't want to go back to dentistry. I hadn't practiced it. And they were trying to box me back into general dentistry. I'm like, I just spent 5.5 years training for something else. I don't really want to go back into a field that I left. It's not where my heart is. And so I took a chance on a research fellowship in radiation oncology. And when I got to my new institution, I went to a burnout committee meeting out of curiosity what they were going to say. And they offered the suggestion that we should focus on our email etiquette. Don't email people during the weekend or after hours. I'm like, okay, but physicians are dying of suicide. Email etiquette, sure, that's a cultural thing. You can also choose to respond or not read it, which is another idea. But I understand that some people, the modeling of not responding over a weekend and nighttime is important for people because we tend to just, okay, if my boss thinks I need to respond to this email, it must be important. But to me, it was a slap in the face. I'm like, we're losing our lives here. So I said, I asked the chair after the meeting who said, if you have questions, let me know. I said, is there a role for coaching? Not knowing that MD Anderson has an integrated coaching culture. So just these things started to unfold by luck. I couldn't even have planned it. They fast tracked me into their coaching program. It's Coach Rice. Rice University has a coaching program. MD Anderson affiliated with them. They send some people through that program, and then the individuals become internal coaches at MD Anderson. And MD Anderson you can have access to a coach as an employee at any level. So my coaching was for individuals who are going through specific leadership cohort. There's training it's focused leadership development, and then some people who might be being promoted or just coming into MD Anderson. That was the focus that I had. I loved that role so much. I was like, I love this role the most of my roles that I have here. I love researching also, but I just felt I could add the most value in that role. So that just continued to develop, and I took more and more training in that. I got more and more experience in that. And then I was trying to decide if I was going to go back into match for psychiatry this cycle. And that was such an existential question that was so deep for me that I was like, you know what? The best thing I did for myself before was sign up for Martha Beck's Wayfinder Life Coaching. It helped me gain clarity in my own life. So I applied to her master coach training, and that helped me to really just get grounded. What do you really want here? I was losing sleep. It was when I was thinking about going back to residency. And when I was talking about what I wanted, some physicians, specifically Dr. Delia Caramonte, said, why don't you look at marriage and family therapy? And I said, because I'm not married and my family never went to therapy with me. They refused. So I was like, I don't know. But then I learned that marriage and family therapy, their whole concept is making sure that we're looking at the system. That's what I do as a coach. We're seeing the systemic impact on the individual. And with anorexia, I think that was the struggle for me, is that I kept it kept being treated like an individual problem when it's not. So I was like, ah, this actually really aligns. And I'm a chief wellness officer by training. It all aligns. It all aligns. It all makes sense. And then for a psycho-oncology, cancer impacts the whole family, the whole system. Yeah, it just felt like that's a slam dunk. It allows me to live within my values as I'm completing the training and also gets me the role that I thought was a really great fit for me.
Amazing. So do you still continue to do medicine in addition to coaching and family therapy? Or how does your, or is it, yeah, how does your, all your degree,
Yeah.
all that hard work, where does that go?
Yeah. I kind of
That's so
shaking my head because I'm
cool.
like, at some point I need to reduce what I'm doing. But yeah, because I became an adjunct professor for the dental school to help teach because I was teaching more of the medical component of medical management for patients that are getting dental care. My specialty is medically complex patients. When it comes to dental school, students often learn the dental component on patients who are quite healthy. So there's not too much complexity. But I was trained to support management of patients who have to go to the hospital for their care because they have bleeding disorders, chronic kidney disease, they have cancer or something that makes the dental management a little bit more complex. In the internship that I'm doing for my marriage and family therapy, it's in a clinic that's got medical, dental, and behavioral. So I'm thinking about going into med family therapy, which would mean being a therapist on a multidisciplinary medical team. That speaks to me as something that really aligns with my vision for myself. And then, yes, I still coach mostly physicians. I contract my coaching to organizations that have physician and organizational health, different healthcare institutions as part of their clientele, but I certainly anyone who is feeling really lost and trying to get back to their why, meaning of life, create a life grounded on their true values, and reintegrate themselves with themselves or bring themselves back home to themselves.
For individuals who've never had coaching before, what is a coach versus a therapist versus a mentor? Can you talk more about that?
Yeah, so coaching versus therapy, mostly there's so many overlaps with coaching and therapy, but we don't go way back and dig into the, okay, what happened in childhood? Let's talk about diagnosis and all these things. But seeing a client now, the impact of their childhood and past experiences will be there. So the coach we often can, why are you thinking the way that you are? Where could that have come from? But it's very much seeing you where you're at, the impacts of your past, and then focusing on the future. So if somebody's really stuck and struggling with profound grief or depression or suicidality, that's for therapy to support until they can get a place where they're meeting their basic needs and their functions and saying, okay, the quality of life's here, I have no safety risks. Well, let's now empower ourselves. And therapists can do this as well. I have a great therapist I'm like, you're like a therapist coach. So it's but I was feeling like for me in my past experiences, this could have been self-driven, but I was just so focused on the depression, the anxiety, what's wrong with me. Whereas the switch for me, and again, this could have been client like on me, the switch maybe could have happened while I was in therapy, but I was like, okay, coaching is going to leverage my strengths. We're going to see the obstacles that come up. There's no pathologizing. The coaching philosophy that I have doesn't tell you what to do. So that's going to be opposed to the mentor who maybe will give you some like more focus on the advice. And I've been here before and here's how I've done it and might instruct you based off of how they perceive. It might be more and more advice given than a coach. A coach really is there to help you to start hearing your own voice, develop the answers that we believe that you have within yourself. And there's often sometimes some recommendations if that person's, oh, what else would you recommend? But it's really focused on getting the answers out from the client and not being the expert, knowing that the client is the expert in their own life, which I believe is a shared philosophy with therapy and coaching.
Yeah, that is helpful. I remember the first time I did coaching was at AMWA, the American Medical Women's Association. They had it was super short, but it was so effective. And I think that was what shocked me most. I think it was like 15 minutes for free. Sign up. I met with let's see, I was probably a third year medical student at that point, and the doctor had nothing to do with what I wanted to do, but was able to give me that third person perspective of not knowing me, but being able to see my situation a little bit more objectively versus fully. It is really interesting, and I can see how it's helpful for I really like what you said when your basic needs are met. And I think that's where the challenge hits is when you don't meet your basic need, that's where you start getting really pathologically depressed, anxious, suicidal. That is where we need medical, psychiatric, or therapy care. But if you're, I like, what, like you said, once you're at a stable-ish place and you just want to find your authentic self, like you said, and fix a key problem, then you can go for it and get and work through those ideas. Am I thinking of it correctly?
Yeah, and oftentimes when we're identifying our limiting beliefs, it can stir up a lot. So I often am a huge advocate for people, if they're at a good point, to do both. If they're studying at coaching, I'm always like, how do you feel about therapy? Just in case, because transformational coaching, we might want to do some deep diving. Typically, maybe it's a hazard or a personality trait, but I like to dive deep in my own personal self-development. I tend to attract clients that are at a place where they want to dive deep. Sometimes it's not always the right time for that because, like shame we talked about earlier, it's really painful if you don't have the self-compassion, the community. It can be dangerous. We can drive people into a shame spiral that I fear because of my own personal experience. There's When Shame Becomes Deadly, that's actually an article. And I fear that a lot of times with the physician suicide rate being so high, I feel with it being such a high shame culture that a person feels that they'd be better off dead than changing their job or doing something differently. Those thoughts can arise when you start to really get down into the deeper layers of where did I develop these thoughts? And sometimes those emotions can happen just so automatically that I'm like, I would love if the person has another touch point on board to make sure that they are fully resourced when those tender spots get poked a little bit. I think that also allows that person to be a little bit more vulnerable, knowing alongside me that we have a team of support that's championing for them and without judgment. And I'm also curious if there's anything I missed when coming from your specialty perspective, your perceived differences with your experience with coaching and therapy.
Yeah, I was trying to think. I think you made a good job. What I liked what you said is it's a team-based approach. And that's something that I came into medicine very much from an interprofessional perspective. I'm thinking back, I was a caregiver for the elderly. I woke them up in the morning. I helped them get dressed. I provide them medicine. I don't know. I didn't know what the medicine was or why they were taking it. And then there were nurses that would check up on them. And then sometimes I would take them to the doctor and I would sit with them. And each different professional had their role. Sometimes they would go to therapy and I would walk them to their therapy and sometimes I would observe because I was trying to still figure out like where was my place. And
Mhm.
I now think I go a couple years forward into medical school and struggling with the rules of not of the hidden rules and I thought about the word of shame that you said of feeling shamed for not being able to be my authentic self and instead be it was like a robot. I couldn't
Yeah.
be
Mhm.
unique. I couldn't be a human. I couldn't show my lessons from my past experience. And I got in trouble a lot for speaking up for things that I thought were not right or speaking up for patients and their needs. So now going into psychiatry and residency where I'm more encouraged to I still in a rule and bubble, but trying to figure out, okay, where's that balance? And I think now that I am in a better mental state, even though I do continue to see my therapist, that I'm so thankful that I've seen him throughout medical school. This is
Yeah.
now like year 6 that I'm
Mhm.
seeing him. And so he's been able to see me through the ups and downs. And so now I'm in a place where I can become a coach for other medical students and then sometimes a mentor, but then also try to figure out, okay, where do I need it? Where can I go next? And I don't know, that was more of just sharing my journey and
Yeah.
seeing places where a therapist was more beneficial or a coach was more beneficial. I remember when I was in the third year and I was going through the where do I fit in family medicine? Do I fit in psychiatry? The coach was able actually helped me with my personal statement in the sense of just finding the me, finding the person. And that wasn't something that my therapist could have helped with. That wasn't something that my mentor at school could help me with. But a coach who didn't know anything about me was magically able
Yeah.
to see, you know what, these are the values that you share. Let's find a specialty that correlates with those values. But
Yeah,
yeah,
I think, the coach helped you find them, right? I think because
exactly.
I think those are the questions the coach is really drawn to asking. And I think that's the benefit. I think the therapist I had, because he had such a coaching mindset and really wanted to get me out of the pathologizing of my own self. Like the whole, okay, you are depressed, but you're not eating, you're not sleeping, you're in a specialty you don't like. It was like, of course, of course you are. And he would make me laugh through the pain, which is often maybe not, it was very appropriate, very strategic,
Very
not
needed.
it was very needed for me. And it's not always what people find beneficial because they can find it to be invalidating. But the way he does it is, I'm like, you are so amazing. I went back to him 10 years later because just what you said, I was having a coaching question. It was meant for a career question. And I knew he helped me with my career decision in the past. So I went to him specifically for the career. He's also eating disorder specialized. So I'm like, he's just the best. TJ Rainey is his name, North Carolina. So good. I just value him as a person, and he's so humble. I'm like, how are you just so good? You're so good at what you do. But his words that really impacted me weren't even about me. It was about his story. He said that he had good grades in school, and his friend said, why are you going into psychology and not medicine? Because he has the grades for it. And it was the same. I'm like, okay, psychologist is great. Medicine's great. Like, why are we putting these into like, why wouldn't you do this? He's because I want to be a psychologist. And I just found, oh my gosh, you actually just did what you wanted to. And years later, I'm like, okay, what would it feel like to give myself that permission? Because I didn't give it to myself, and people won't. You were complimenting me on the fact that I allowed myself I don't know if it was a compliment, but I took it as one to
It was.
pivot. Yeah, to pivot. But I didn't give myself that permission, which my YouTube channel used to be called Permission to Pivot, because I'm like, that was my stuck point. I had so much shame about quitting because we're taught to just choose and stick with it. And quitting is taking a spot from somebody else. Quitting surgery, like what would that mean for me? And how was I ever going to find my worth and value? So I'm back with the same therapist. I just am really appreciating having that support and the different approaches that he provides. So, and I appreciate you sharing it too, and how at different intervals in your life you were trying to say, okay, what need isn't being met here, and who's the person I need to go to for this in particular?
Yes. Oh, something that you just said there remind me of a previous individual that I interviewed, Dr. Jessie Gold, who's a psychiatrist who just wrote a book. And she was a couple episodes before, so I'll make sure I link it. But she said something, quitting is valid. And just
Ah,
like that hit me so much because it's not okay in society to quit. It's
yeah.
especially in childhood, we're taught quitting is for losers or like giving up. But no, there's different paths for everyone, and you can quit if it's not your path to go somewhere
Yeah,
else.
absolutely. I think some of the least courageous things we can do is stay in something just because we're afraid of quitting. It's if we frame it in that way,
Yes.
it was actually the more safe thing to do, or I would say the less noble thing to do by staying, because that was my safety. I'm just going to say I might have died, but I would have stayed and I would have proven what. Or I could go find, and we make these choices when we're at an age that's so young, developmentally. Like, gosh, our values and our priorities shift, and we learn a little bit more about ourselves. And okay, give ourselves permission to bring that new awareness to say, before I was really so many people go into medicine because their family members push them and their culture makes them feel like they have to do it, and there's a lot of resentment. And sometimes when people realize that, they can still fall in love with medicine and make it their choice to stay, or they can say, you know what, if my family didn't tell me that, I would be going and doing XYZ, so I'm going to go do that. But giving ourselves that permission can be a big hurdle for people, and I think it's a really important hurdle to investigate, because I do think it could save the lives of many who feel trapped and think that there's no way out other than suicide.
Yes, and I put a note to myself that I will put this in earlier, but since we're talking about suicide, and I'm going to put this at the beginning. We are going to be talking about, this is a trigger warning, talking about mental health topics, including suicidality and suicide ideation. So if that is a triggering topic, I'll make sure that to include the different spots of this interview that you can skip over. So make sure you still get all the meat, all the tips and advice, but also know that it is okay to have those thoughts of not being here. That is a trigger and trauma response. And as a psychiatrist, I'm saying that there is help. You don't have to give up. There are people that are there to support you. You're not alone. I know in those time periods you can feel so alone. I've been there. I've had those thoughts. And I know Dr. Rigert will talk about her thoughts like that too. And I will put the number below and you'll see it up here. 988 is the number that you can call and you can connect. If you are a veteran or a military, you can click 1. I work in the VA, so that's something that I connect a lot with. And there is also a texting, so I'll make sure to put that there. But I always like to say 988 because it's an easy number. It's like 911, but with the 88. And yes, if you are a doctor, or if you are not alone, and there's nothing wrong with you for having those thoughts. It just means that your body and your mind is saying that there's something unsafe here. And it's a flag to just tell you, hey, pay attention to me. Pay attention to me. We need to do something. So
Yeah.
that was a thing for suicide that
Oh, I appreciate that. Yeah, I appreciate it. And I think there's that combination between not wanting people to spiral and also wanting people to know they're not alone. So I think you this is very helpful.
Thank you. And I know I do want to start wrapping up here. So you provided so much advice from your journey, but if we could sum it up, some pearls of wisdom that you would like to leave for our viewers, especially those who are struggling.
I think what you were saying about even identifying what path you wanted to go on that aligns with your values and the challenges with masking parts of who we are and feeding into these boxes, it got really strong detriments on our mind, body, and spirit when we feel like we can't exist and truly be who we are. So if you're feeling some of that weight, some of that burden, I think that exploration of who are you? What aspects feel like you're not able to honor them? For me, it was being a highly sensitive person with neurodivergence and being told to fit into a box that didn't align with my values, and understanding that negative consequences of molding to fit into places are high and often exacerbate feelings of loneliness, though we often mold ourselves in hopes that we'll have a sense of belonging. That belonging comes from belonging, one, to yourself, identifying and reintegrating all those parts of yourself, seeing where you are safe to express them. Just as you mentioned, there are realities where it's not safe to fully express our true self. I'm really great that you're an advocate and that you're in the field that you are, because patients in mental health, me as somebody who was inpatient psych, with anorexia, it's a very vulnerable population. And when you have vulnerable populations, you have high risk for people to take advantage of those patients. You have high risk for people to take advantage of the vulnerable populations that exist in training. They do happen. Those personalities that really thrive off of that power and control. So observe that. If you're feeling like you're being oppressed, get support, get help, find the community. We're out there. So really, it's about leaning in. Who are you? What are your values? Find the path that aligns with those and the community who supports you for who you truly are.
I love that. And lean in. I think that is a big aspect of what you just said. We want to lean out to lean in. So thank you. I appreciate you sharing your journey with us. We talked about a lot of different things. We talked about the residency and the challenges, emotional, physical, spiritual, that you had. And you were able, even though the surgery path or the military path didn't turn up like you were imagining, that didn't stop you. And you were able to figure out, okay, where do I fit? Where do I fit in society, in medicine, and also learning who you are and working with taking time to address your mental and physical health in order to be able to be there for others was key that you talked about. You also talked about how you were able to go from being a research fellow to connecting also with a committee for burnout, going into coaching, how that additional weaved into your path and how you found a way to keep that more represented who you are and your values and how you wanted to leave a mark on society and humanity. And you finished off by providing some great pearls of wisdom of having that permission to be yourself and to lean in. So I appreciate Dr. Rickard for being here and sharing your story with us.
Yeah, thank you so much for having me. I'm looking forward to connecting more in the future.
Can you share again your YouTube channel and how we can best connect with you?
Yeah, my new YouTube channel, so Dr. Rigert, A Life True to You. I don't foresee that I'll change it. In terms of the name, it's changed from Permission to Pivot before, but if you struggle to find it, reach out to me on LinkedIn and I will point you in the right direction. I'd love to have you over in that community. It's free. You'll see people that come from all different walks of life trying to find their way, and I hope that supports you in finding your way back home to yourself as well.
Amazing. I can't wait to connect with that community too. I think it's so important, especially like you said, high achievers. It's good to become more grounded with others.
Yep. Yep. Hopefully we'll see your face there as a guest and they can hear more about your story as well.
Amazing. I also want to share that we spoke about a lot of different key aspects with that I think will relate to a lot of different podcasts that we've mentioned. I've interviewed a couple other physicians that, interestingly enough, that coaching ended up being also their path. So there's definitely something there that into the path. And so I will link to the other physicians if you found this interesting and want to learn more different perspectives on how physicians went from being medical doctors and still are medical doctors, but added this additional toolkit to their toolbox. Also, you can check on my website, medpsychmoss.com, if you ever want to have, I can't call it coaching because I don't think I'm there yet, but if you're a medical student that wants to hear more and maybe relates to my story or through other ones, you can find my story there and different tools that I've created to help during these different struggles. You can also find this podcast wherever you get your podcasts, and you can follow me at medpsychmoss. So thank you everyone for joining. We'll see you next time.